Since 1995, Chain of Hope has been working to help save the lives of children in developing countries. Around 1 in every 100 children is born with a heart defect, but often, many such defects can be corrected with a routine operation. Unfortunately, in some parts of the world, the treatment needed simply isn't available. Chain of Hope was established to help children and young adults who might otherwise have little chance of receiving the life-saving treatment they need. Children like Tesha in Ethiopia, a 6-year-old girl diagnosed with tetralogy of Fallot's, who had been waiting since birth for her heart to be fixed. Chain of Hope regularly coordinates missions to those areas of the world that most need the expert help it has to offer. The charity was founded by Professor Sir Magdi Yacoub, a pioneering heart surgeon and the man who continues to lead many Chain of Hope teams in overseas missions. These teams are made up of experienced medical professionals, all of whom give their time and expertise voluntarily, bringing much-needed care to people just like Tesha. Tesha was treated at the Ethiopian Cardiac Center in Addis Ababa, a unit that Chain of Hope helped to establish in 2009. This little girl is one of many patients to have benefited from the specialist care this center can now offer, including the expertise that the charity's team of surgeons, anesthetists, and nurses provides. And this is just one example. Similar projects have been initiated by Chain of Hope in a number of countries around the world, including Egypt, Mozambique, Jamaica, Kenya, Brazil, and Ethiopia. Chain of Hope volunteers also spend time educating medical professionals from these countries. It is important that the charity supports efforts to improve the healthcare infrastructure at those hospitals in which it is active, and the teams of volunteers who travel to work in these units bring priceless experience with them. Sharing this experience with local healthcare professionals dramatically increases the longer-term value of a Chain of Hope mission. But it's not possible for all specialist treatment to be undertaken overseas. Often, very sick children will be flown to the UK by Chain of Hope to receive the specialist care and attention they require at a leading London hospital. Typically, a child will be accompanied to the UK by a parent or guardian and live in the home of a host family before and after their procedure. Host family volunteers offer a safe and supportive environment, assist with transport arrangements, and help to minimize any anxiety for both patient and family. On occasions, these volunteers will have become involved with Chain of Hope because a child of their own has suffered from heart disease and they have personal experience of the issues involved. Chain of Hope's work will not be completed until there are sustainable cardiac services in every country around the world to provide treatment for children. A growing number of young people in the developing world now suffer major heart disorders, and as many as 15 million children die every year. In order to help save as many of those lives as possible, Chain of Hope relies on the professional support of many people, and it relies on the generous donations of many more. This support is vital to our continued success, the only way of enabling us to provide the care, drugs, and ongoing support necessary to save the lives of children like Tesha.